Hello, this is Social Work 722 discussion board for the case study of Yasmine. For the first question, where it talks about a psychiatrist had previously diagnosed Yasmine with major depressive disorder, recurrent in remission, now that Yasmine is my client, the main diagnoses that I would give her would be binge eating disorder mild, because as she stated in the case study, she's binging about 2 to 3 times a week, so she hasn't quite reached the level required in order to diagnose her with moderate. The other diagnosis that I considered throughout the case study was possibly bulimia nervosa, but Yasmine didn't talk about ever having any sort of purging after her binge eating, and so that kind of ruled that out. And then nothing ever really came up for anorexia nervosa, which was the other one I considered, because she never really talked about purposely restricting her food. And so the specific reason I ended up picking the diagnosis of binge eating disorder mild over specifically bulimia nervosa was specifically because she wasn't experiencing, or at least she never talked about experiencing any times of purging after her binge eating sessions.